Hello, everyone, and welcome to this episode of the SIO Member Spotlight series. I'm your host. I am Dr. Tabarak Qassim. I am a resident doctor at Cambridge University Hospitals in the UK. I'm also the co-chair of the SIO Education Special Interest Group. I am so thrilled today to be sitting down with one of our most incredible minds at SIO, Dr. Santhosshi Narayanan. As many of you know, the Society for Integrative Oncology is entirely dedicated to advancing evidence-based integrative oncology care and improving the lives of people affected by cancer. But behind the research, guidelines, trials, there's incredible individuals driving this field forward. This series is a chance to get to know those individuals. So we'll be diving into their personal journeys, what sparked their interest into integrative medicine, and where they see IO heading forward from now. So let's welcome today's guest, Dr. Santhosshi Narayanan. Dr. Narayanan, do you want to tell us more about yourself, please?
Sure. Well, thank you, Dr. Kassim, for doing this. And it is such a pleasure and honor to be here and discussing about Society for Integrative Oncology. Both you and I know how much we can do for our patients by integrative therapies. I have worked with you very closely from the time you were a medical student to a successful resident with deep interest and commitment to integrative oncology. So we both know that how important this is for our patient. So what I do is I practice integrative oncology. I'm a clinical associate professor at University of Texas MD Anderson Cancer Center, and my full-time practice is dedicated to integrating integrative therapies to in caring of patients with cancer. So I also teach, I'm involved in educational efforts, and I also do research, publishing our data on how integrative practices influence patients. And I participate in SIO as well to see how we can help and work with each other and collaborate to move the field forward.
Beautiful. Dr. Narayanan, you looked absolutely stunning today, but I'd like you to kindly move a little to the left so we can see you more. To the right, sorry, to the right. A little more. There you go. You're in the center now. Perfect. So, Dr. Narayanan, tell me about your journey through integrative oncology. How did the spark first begin?
Well, that's a great question, Tabarak, and I will share with you. I'll take you back 6 years ago, not 6 years, I would say 8 years ago. And 8 years ago, I was an associate program director for Onco-Hospital Medicine Fellowship at UTMD Anderson, and I was clinically practicing onco-hospital medicine. And one thing which struck me in caring for my patients was that patients were looking for something more. And we often talk about their health, their cancer, how is their numbers looking, how their symptoms can be managed, what changes in medications we could make. But patients were looking for more. They were looking for approaching them as a person, a holistic approach. They were thinking about how somebody can actually understand how they feel. They want to do everything in their cancer journey. They are not wanting to just hear about what we could do for their cancer. The whole person, the caring for the whole person with cancer and a holistic approach is what I felt that patients needed the most during that time. There are some of the patients who are exercising very actively even before the cancer. They want to know how they can get back to their normal life. Some people are under extremes of stress, worried about their future, worried about the future of their children. So they want mind body care and how do they manage their emotions. So they wanted, I saw there was a big gap there. And I actually started a meditation trial for and that incredible mentors, Dr. Reddy, who was at that time working with me in the hospital, and she worked with me a lot to uncover like what exactly is I am wanting to do. And then we worked with integrative medicine. I did this first trial of meditation. Patients were very satisfied with that. And then I switched to our integrative medicine department, and I would say that I'm totally thrilled and excited that every single day when I talk to patients and offer integrative therapies, it gives me deep gratification that I'm able to take care of the patient as a whole.
As a whole, perfect. I know this is exactly what patients are looking for. And to expand your learning through integrative medicine, what formal programs do you think played a major role in your journey? Yeah. Hello?
Yeah. So I would say there are several. I also did Integrative Medicine Fellowship, which also had a combined Masters of MS Ayurveda with MIU. And This program, which combined the Integrative Medicine Fellowship with Ayurveda, helped me get trained in both Eastern medicine from an Ayurvedic standpoint and then integrative medicine. And then my knowledge in oncology by working with MD Anderson patients for a long time, this is my 11th year at MD Anderson, gave me an opportunity to combine everything that I have learned so we can offer what we have in caring for people with cancer.
Perfect. And how does it work now at MD Anderson? How do patients know about this integrative medicine center? Do you bring it up spontaneously depending on what the patient is asking for, or they exactly get referred to this department?
So the referrals usually come from different oncology teams. So the way it's structured is that there are several oncology departments. There is breast medical oncology, there is GI medical oncology, GU medical oncology, sarcoma, leukemia, lymphoma. So what happens is either the patient asks questions about integrative therapies. Hey, can I have acupuncture for my symptom management? Or sometimes people would say that their neuropathy is refractory to treatment, or they would want to explore some herbs and supplements, or they're asking for more advice on their diet and exercise. So when these questions surfaces up, the primary oncology teams at MD Anderson think of referral to integrative medicine. And we have worked together for a long time in MD Anderson. So, therefore, most of the teams are aware that there is integrative oncology, there's integrative medicine center that they can refer their patients to. And sometimes it is initiated by the oncologists themselves because they have attended the grand rounds in integrative medicine and they heard that, okay, these therapies can really help their patients from a different perspective, which is not very conventional. And then they would refer. And then the presence of guidelines. We have SIO ASCO guidelines, which is highlighting the role of integrative therapies, which helps the oncologists think about the integrative therapies when their patients are complaining of certain symptoms, like hot flashes, for example, or neuropathy or cancer pain. We have SIO ASCO guidelines for cancer pain. So these are the guidelines that SIO and ASCO have collaborated to work together, and we do have it. So this is also one of the reasons why the referral becomes easier. So from the oncology departments and palliative care, supportive care, rehab departments, psychiatry, all these departments think of integrative medicine referral for their patients when their symptoms require something else to be looked at.
Wow, beautiful. And I'm sure you've had tens of if not hundreds of consultations 10 years later. What is your single most proudest moment when you utilize integrative medicine practices, that one patient where you include integrative medicine and it's made a remarkable, significant difference to this patient's quality of life?
Sure. So that's a great question. but it is a difficult to answer question for one reason is that there are many patients who actually tell me. So it's very hard to narrow down to one patient who has benefited from integrative therapies because many patients, I can quote two, three examples where I would see a patient who completely wants to give up aromatase inhibitor therapy because she is having joint pain, she's having hot flashes, she's very irritable. And then when we incorporate acupuncture in her care, she's able to tolerate the treatment better. She's able to take it and decrease the recurrence risk of her cancer. So that is just one example. And people with radiation, with dry mouth, and when we do acupuncture and we treat them, the patient is able to eat better. So those are just few examples. But one story that really touched my heart was the use of traditional medicine, Ayurvedic medicine, in one of my patients that we recently treated. So this patient had cholangiocarcinoma, and we all know that cholangiocarcinoma does not have a great prognosis. And there are treatment options, and this patient was on chemotherapy. And the patient was referred to us to explore integrated therapies. And we tried all the integrative therapies for this patient: acupuncture, massage, diet, exercise. But one thing that the patient's family wanted him to do was Ayurvedic medicine. And patient from a South Asian background he had access to different Ayurvedic physicians, and he got all these opinion, and he wanted to do this. But then people often hear from the primary oncology team not to do anything. So sometimes people are in a state where, what do I do? I have these resources. I have the chemo. I don't want anything to impact my chemo, but I want to do something more than just the chemotherapy. So that's where a lot of these patients, especially stage 4 patients with prognosis which is not great in certain types of cancer, are. And that is where I was able to help this patient. We had a call set up together with the Ayurvedic practitioner, myself, and then we communicated very closely with the oncologist, and we explored all the options. And then finally, we decided to do more dietary Ayurvedic options for this patient and not do like a lot of herbs and supplements which can interact with chemotherapy. And the patient was very satisfied. The patient felt, and especially the family felt, that all their options were explored, and that they had a satisfaction in the sense that there was nothing, there's no tables that were not turned. So I think that satisfaction when the patient gets, and the way they feel, I think that itself helps them heal, that they did everything possible for their care. So that is one story that really touched me, and I felt like the patient was very much into making sure that he explored everything that is available out there, and he did everything that he could do for him. And that is important for the patient and the family.
100%. I absolutely believe it. Just listening to the story is inspiring enough, but I 100% believe that when it comes to cancer, you shouldn't be passive about your treatment in the sense that you're not, I mean, in my opinion, you shouldn't be just receiving medications, chemotherapy, but rather be active about seeing what else, what other options you could do actively from your end to, I wouldn't say reverse it per se, but to limit cancer progression to the maximum. And
Agree.
And yeah, so over those years, is there any particular mentor that you'd like to point out over those past 10 years? I'm pretty sure you work at such an inspiring environment, and the Anderson, one of the top cancer hospitals in the world. Must be seeing inspiring professors walking down the corridor every single day. I'd like to know who exactly influences Dr. Narayanan's work.
Thank you. I would say there are so many people, there are so many mentors who had influenced my work. When I first started, my first mentor was Dr. Marina George, who's currently the vice president of inpatient services at MD Anderson. And then she introduced me to several other mentors. Dr. Akila Reddy has been an incredible mentor for me. She has identified my interest, helped me with my first trial of meditation in cancer patients. And then she helped me meet Dr. Eduardo Pereira, who's our department chair and also the senior author for our ASCO SIO guidelines. And he inspires me every day. And he has transformed palliative care in a way that is very evidence based, along with so many other experts globally. And the way what he has done for palliative care and supportive care inspires me every day to do something like that for integrative medicine in collaboration with everyone else and SIO. So he inspires me every day. And of course, there are other great people that I work with. Dr. Lawrence O'Cohen, who was a great mentor when I started in integrative medicine, and I continue to work with him in several projects. And we have Dr. Gabriel Lopez and my wonderful colleagues, Dr. Morse, Dr. Delacris, and so many others that I work with. And in SIO, the first person who got me to SIO was Dr. Santosh Rao, and he helped me get the Ayurveda Special Interest Group established in SIO because that was something which was close to my heart, and I felt like SIO did not have it. So we put together our first special interest group in Ayurveda. And then our global committee, as you know, Constantina, I work very closely with, and she inspires me every day, her energy, her enthusiasm, her work for the field. And you also, and your energy and your enthusiasm when we work together in global committee. So I think there's a lot of people that I get inspiration from. I mentioned few names, but there are so many other people to mention, like Judith Lacey and so many others, and that I enjoy and love working with in SIO and in MD Anderson.
I absolutely agree. Especially, I do want to make a special, I do want to especially give a shout out to Dr. Santosh Rao because he was the one that introduced me to SIO to begin with when I was back as a medical student back in 2022 or 2023. And yes, so as we're advising people of lifestyle changes, we are ought to practice what we preach. So what integrative medicine practices do you practice in your daily life?
So I would say that I try to do everything that I tell my patients to do. So when I'm talking to my patients, I'm talking about diet, exercise, mind-body practices, sleep, symptom management, and then we also talk about safe use of supplements, not to just blindly use some supplements based on preclinical data to make sure that it is safely used and the adverse effects or patients are educated on the adverse effect and they make an informed decision. So the things that I commonly use is I eat exactly like what I ask my patients to eat. I avoid desserts as much as possible, and even if I have to, if the portion sizes are extremely small. And I exercise also. I exercise exactly like how I tell my patients according to ACSM recommendations. That helps me face the same challenges that the patients face, like the time constraints and the family and the work. And I meditate regularly, and meditation is the reason that I got interested in integrative oncology. So I've done several types of meditative practices and I love most of them. I do yoga, I do pranayama, and I love music. I used to be a singer and dancer before joining medical school for just fun and passion, and I learned both music and dance. So those are some of the things that I don't do as often, and that's something that I would like to do going forward. And then when it comes to integrative therapies, I do use acupuncture. I do use massage for my own healthcare. And supplements, I'm very careful, exactly like what I tell my patients. So I would say that I use many approaches, and I see patients using that all the time, and also our colleagues at SIO using all the time, and respecting each other's time, and it's very exciting to know that we can actually practice what we're preaching.
Absolutely. And one thing to point out is that you don't have to become ill to start practicing the integrative medicine practices. Just as we are, they already make such a huge momentum to our daily lives. And I can absolutely vouch for you and your health. Seeing you for the first time at back in yeah, 2 years ago in California, I was genuinely stunned by how physically fit you looked. I still remember that pink blazer. I'm not sure if you recall. So I absolutely vouch for. I see the effects on your physical body firsthand.
Well, thank you. Thank you. I think that is very important for our patients too, because as we know, the exercise is showing that there is a mortality benefit, and we have studies in colon cancer, and we have known this for a long time in integrative oncology. But helping the patients get the guidelines in exercise, and for that, we should be able to face the challenges that our patients face too. I think that really helps when we practice as well, because we will face many of the challenges that patients will face. And on top of it, our patients are dealing with cancer and dealing with side effects and the fatigue. And then we learn how difficult it is for them to do the same thing that we are doing, which is challenging. So I think in that perspective, when we all do what our patients have to do, it really gives us a big insight on how, and we become more empathetic and kind to help patients stay compliant. But
Totally.
thank you for your kind and nice comments. I appreciate it.
Thank you. Yeah, absolutely. You're forming a bridge. As you're both using the same practices, you're building a bridge between both yourself and the patient. And,
Exactly. Yeah.
and so moving on to the very last question. I already know the answer, but I'd like to hear it from you. Where do you see cancer care within the next 10 years?
So I think that so far we have come to a place where, as a field, integrative oncology is already appearing in the standard of care. You see the integrative therapies in NCCN guidelines. You have the ASCO SIO guidelines. So it is already appearing in the standard of care, which is a big success for integrative oncology, the field as a whole. And I think where I see this going forward is access. I would like to see how most people with dealing with cancer are educated about this, and the cancer providers are educated, and we can actually deliver this to the patients. Like, for example, the trial that Dr. June Mao is doing to get the implementation. I think implementation is one area that I like to see the field growing and making sure that everyone with cancer are having access to these therapies. And the other area where I think where we are going in the next 10 years is immune system too. How can we improve the immune system of people dealing with cancer? What integrative therapies we can offer? I think that is the area which is still more in preclinical research, and there are some therapies which are not very highly evidence-based. I would like to see evidence in those areas. How can we integrate those? That evidence is strong and preclinical, like medicinal mushrooms and some of the Ayurvedic treatments, and bring that into an evidence-informed or evidence-based clinical practices. And then collaboration is the third area where I see that the collaboration is very good right now, but there are still few teams or few people who still feel like, oh, integrative therapies may not be evidence-based, and that may come from some of the treatments which are not safe, and they have only had exposure to those treatments and side effects. So that may be the reason for discomfort in the minds of some of the treating oncologists. So collaboration and doing this together safely is another area that I would like to see us doing better in the next 10 years. And I think as in SIO, we all can work together to see how we can work on these different areas of implementation, collaboration, and clinical practice, and safety, and research, and education, the work you're doing, and many others. We can make everything work together and streamline all our efforts in making this happen in the next 10 years.
100,000%. Commenting on implementation, I fully believe in this. Theory is one thing, but if you don't practice it and you don't implement it, then it's as good as nothing really. Knowing something is something, but implementing it within your daily lifestyle is another thing. And collaboration wise, absolutely. And I think Dr. Nina Fuller-Shavel, along with Dr. Massimo Bonucci, Constantina are doing an amazing job just recently now in the SIO Europe, the second version in Rome. So the momentum is going. So it, it's looking good, I guess.
Yes, yes. I would say that research, collaboration, education, the recent conference you mentioned, all of that is very exciting in our field.
Perfect.
And Iran too was along with Nina and Massimo and all of them did a wonderful job with both the conferences, SIO conferences, and Constantina with our first SIO Cyprus conferences. And more, we would like to see more and more of these in many countries globally. And we all work together to make this happen, the dream come true.
Absolutely. Before we end this, any last message that you'd like to let us know, deliver?
The last message I would say is that there is great momentum,
Mhm.
and we continue to work on this momentum, and we continue to practice what we preach, the integrative care of oneself. So I would highly suggest that we all live what we are talking about, so that there is true integration, and we all do this in the most evidence-informed manner for our patients, considering safety. And I think the future is bright, and we can do much more for our people with cancer in taking care of them. And we don't give up in this area, despite there are so many challenges in our field, like funding for research and many other challenges. We continue to strive through it and make it happen for the well-being of our people with cancer.
Absolutely, 100%. And to our viewers, one last message from me, and that is if you'd like to learn more about integrative oncology and what exactly it constitutes, our website is incredible. It's got so many research papers speaking of integrative medicine and its effect on patients, as well as we've got a research committee that reviews papers on a monthly basis and releases them to us, the audience, to read and learn more about this. There's also modules released by the Education Committee, which help you implement the guidelines that were released by SIO and ASCO um, to help implement them in your daily work dealing with patients. And last but not least, we've also released the comprehensive integrative oncology textbook, which speaks of the various integrative medicine practices and how you could implement them within your daily work dealing with patients. I believe I've contributed to chapter 54, guided imagery and progressive muscle relaxation, and Dr. Narayanan has also contributed to a chapter that speaks about Ayurveda. Correct? All right.
Yes, that
Okay,
is correct.
perfect. Thank you so much for joining us on this episode, and I look forward to seeing you on our next one. Thank you.
Thank you very much.